Yeah, I mean, some of them, they do not have any official power, but I can tell you that they are very powerful.
Hello and welcome to our podcast, Gender Matters, Women's Representation and Participation in Humanitarian Aid. I am Simfora Bangasimbo, and this episode is made in collaboration with
Fatih Barsak,
Elvire Foua, and Claire Inderkummen.
We are first-year students at the Graduate Institute in Geneva, Switzerland, and have prepared this podcast for our course, Human Rights and Humanitarianism through the Concepts. Despite the emergence of a genuine care for human suffering, the origins of humanitarianism are marred by imperialism, ethnocentrism, and paternalism. Historically, this has resulted in the voices and contributions of women in humanitarianism being excluded and downplayed. Fortunately, as women's movements around the world have gained traction, there has also been an increased focus on including women in the field and tailoring programming to directly reach women. International recognition of the gendered effects of crises largely began in the early 1990s, and many different aid organizations have added gender equality as a priority in their operations. Demonstrating some of the progress made in female representation, the United Nations Office of Coordination and Humanitarian Affairs estimated in 2019 that 40% of humanitarian aid workers providing critical relief services around the world are women.
Despite the uptick in female participation, we still see imbalances in the number of women who hold leadership positions in the humanitarian organization. In 2016, only 9 out of 29 UN humanitarian coordinators globally were women. Disparities exist in another aspect of humanitarian work as well. All time, there are gaps between the services female beneficiaries require and the ability of aid organizations to provide them. Cultural and gender norms can dictate who is able to access which people and in what capacity, making it even more important to have ample female representation in the field. To further explore the importance of female representation in humanitarianism and the barriers female aid workers face, we had the pleasure of speaking with Nelly Staderini, the medical leader of Women and Children's Health Unit at Médecins Sans Frontières, Geneva headquarters. Let's listen to our interview.
We are on location at the Médecins Sans Frontières building in Geneva to interview Nelly Staderini. Nelly Staderini is a French midwife with a public health diploma. She has extensive field experience in various humanitarian contexts, including in Africa, Latin America, and Asia. For more than 10 years, she has been the Sexual Reproductive Health and Sexual Violence Advisor, and since 2019, she took on the role of medical leader of the Women and Children's Health Unit in the medical department of MSF Switzerland's headquarters. She is also the author of various publications. Thank you so much for being here with us today, Nelly.
Hello.
We have a few questions for you today to learn more about your experience as a woman working in the humanitarian field. So, what are some of the constraints you have faced as a woman working in this field?
The constraint. I think the main one that came into my mind is being a mother of 4 is pregnancies. So, I mean, I'm old enough to have the privilege to be able to be pregnant on the field the 4th time. So the first one in Afghanistan, second one in Guinea, the third one in Chad, and the 4th one in Burundi. So I have various experience of conducting a pregnancy on the field, but I think that today it's much more restrictive. There is some rules and regulation, and it's even difficult also to take the plane if you have to come back in case of emergency. So I do also, and I'm part of the people writing those policies inside the institution, but I can see that there is more restriction compared to the time when I was on the field. And in my mind, this is one of the main differences between male and female, yes.
Wow, thank you so much for sharing that. And how does that compare with childcare after you have the child?
So when we were in the field, we had up to 4 kids, and they were taken, at least the school was paid by the institution, the transportation as well, and we had nanny at home, so sort of privileged way of educating kids. This is one of the reasons why we decided to go back to Europe and to say, okay, let's go away from all those privileges, honestly, and let's also educate them in a more normal way. But voilà, so there was this, what we call the family position. I have the impression that there is less and less family position, so I'm not so sure that you have as opportunities as we are a few years ago on that.
Yes, thank you. That's really important to consider. So in the field, have gender norms in some of the places you've worked hindered or enhanced your ability to provide aid?
Yes, so the thing that came into my mind, and I was young for sure, but it was in Afghanistan and it was during the Taliban period of time. So I think one of the tricky emergency that I went. So Talibans were interesting group of people because of the heterogeneity of them. So some of them, they were even so strong that forget about being a woman talking to them. But for others, they were much more open. So we could have some discussion. And I remember that we did organize the International Women's Day, and they were finally agreed to give some flowers to the women. So it's also, you don't have to put internal barriers on the top of the official barriers. I mean, I think everybody can change, and the beauty of our work is to challenge all those barriers. But for sure, the Taliban were not the easiest one to deal with as a woman.
This is a very interesting point that you raised. Now, have you noticed different kind of barrier in different countries you have been working?
Yes, so again in Afghanistan, but also in Pakistan. I've spent 9 months in Pakistan, and it was my first mission. I mean, you need to wear the well, which is not something that is easy on a daily basis, I must say. And we were very happy not to have to wear it in the delivery room and during the duty. But you all the time have to think about that. So, I mean, all the team was laughing about me because I was forgetting that. And it's very interesting to see that they understand that you understand, and you do not do that because you want to offend them, but it's just because you are coming from a different world and perspective.
So do you think having more women in this field like aid and it increased the ability to offer services to female beneficiaries?
Yes, so this is really something that today we are putting more and more attention. I don't like the quota, so I don't think that we need to go for that, but I prefer the analysis. So, for example, we do a lot of health promotion in the community that we work with, and for sure, if you see that 90% of the health promoters are male to address some sexual violence topic, it's not going to work. I mean, if you want to open a discussion, you need to be aware that you need to have this gender balance. Or if you want to talk mainly with women, in some societies it's okay to talk with men, but in some society they will tell you no. So the first thing that you have to do is to discuss with the community to understand what do they want and to adapt to that. So it's unfortunately today sometimes we just realize that it's still not adapted, and we need to discuss with the team and to make them understand that. Yeah.
During your career, have you seen the number of the female humanitarian aid works increase? And what about in position of power?
Yes, so I have the impression, but I don't have the data behind me, but I have the impression, and also if I'm hearing about the number of medical students, there is even more female than male today. So I can see that even the world in which we are today, there is more female in a position to get those things. What I can see in MSF, like a few years ago, I think all the directors here in Geneva were female. So we have a DG, a comms director, an ops director, a medical director. So I was very impressed by that. And now I think it's go back to nearly all male. So it's just to say that I think it's a very fragile state.
Do you think more representation at the highest level will result in better outcomes in the field? Or did you see the differences when more women were in the higher power?
I think you have some males that are very feminine in their way of thinking, and then it does work. But I must say that yes, I think more female are needed in the hierarchy. It's sometimes a different way of thinking. It's putting attention on the different things. I mean, one of the key example today is related to the COVID pandemic, when I think it's one of the first time that is so clear that you have more than 50% of the caretaker that are female and much less than 50% of female that were in the decision making position. So this is a very clear example that I think we can work on. Yeah.
And so to continue with that, can you discuss the importance of involving local women when you were in the field?
Yes, local women are very important because they are from the community that we want to work with. And not only it's important to have them on board, but also to have their perception about what's happened in the community. They are also the one that is going to tell you how you can talk about things and when is the best moment and with who is better to talk. So, I mean, they have a huge knowledge about the community and they are definitely, I mean, some of them, they do not have any official power, but I can tell you that they are very powerful.
Thank you for raising that point. And you touched on this briefly when you mentioned like quota systems, but as female representation increases in this field, how do you think aid organizations can prevent tokenizing and underestimating the ability of women to contribute to humanitarian work, both in their capacity as workers and then as beneficiaries as well?
Yeah, I think it's important to have data, disaggregation possibilities. So not only how many women and how many men, but also the others, so all this LGBTQI population that in terms of beneficiaries are today increasingly seen in our context. So if we do not have this possibility to recall the data, then we have an issue. And based on the data, it's the analysis. So what do we want to do with that? Do we take into consideration and how do we want to act on that? So one thing is for the beneficiaries, and then for the staff, local staff, international staff, what are we talking about? I mean, is there a gender balance? Do we reach what we think have to be reached or not? And to act on the reality. So I don't like the quotas. I don't like to say that this is what we need. But I think we need a reflection on if it's not happening, then what does that mean?
I think that's a very important point moving forward for aid organizations to consider.
So the question I want to ask is if throughout your career you have witnessed an increase in targeted generated programming offered, and what type of program?
Yeah, so I just come back last week from Kenya. So we have a new project in Mombasa Island since a few months that is targeting the sex workers, and mainly the sex workers, the LGBTQI population and the adolescents. So for us, it's a new area of work. And the other context where we are also targeting this, what we call key population, is in Honduras, in San Pedro da Sula, which is one of the most dangerous city on earth. And voilà, so I have in mind those two places.
Yeah, absolutely.
Are there certain position or job that you see women placed in? Is it because their qualification or because they are women?
So I think one very good example is from where I'm coming from as a midwife, is the midwifery. So in MSF, we have nearly 100% of the midwife from the international pool that are female. And one of the reasons is the fact that in most contexts, the woman prefer to be seen by the midwife, the female midwife. But I must say that I think in South Sudan and in Burundi, it's mainly male. So it's very interesting to see that from a field perspective, you still have contexts where it's not an issue at all. And even it is more male than female that have this midwifery position. But then we don't get them to the international level. I have another example, which is a little bit the opposite, is when we did open the maternity in Mosul in Iraq, and it was just after the end of the Daesh period of time. It was a very sensitive period of time, and when we did open, the team told us we can't have male gynae because nobody is going to accept that, and even to have staff from Africa, that was for them challenging. So we did respect that because we had so many other challenges. So we say, okay, let's not make things more complex than they are. But we were keeping that in mind, and we were asking all the time if it is something that can be changed. And now, after a few years, we have an African, he's coming from Rwanda. So this is a gynae advisor here, he's based in Berlin, and he's doing yearly field visit without any issue. So I think it's very interesting and important to put this gender lens in perspective, but to challenge all the time, what does that mean and why? What are the reasons behind? There might be some good reason, but there also might be some reason that you can challenge and you can make things moving.
You've touched on this a bit already, but what kind of progress do you think will be made if more women are given opportunities in humanitarian aid on equal terms?
Well, I think that anyway, the world is 50-50. So why not in all level? Again, I think we have sometimes different way of raising things or different perception. And so I see the added value to have a combination of both, even if sometimes I can see female acting like male and male acting as female. So it's not so black and white, but we need to reach not only equity, but equality. Yeah.
Great. Thank you so much, Nelly. We cannot thank you enough for agreeing to share your insights and your experiences with us as we research how female representation impacts the ability for organizations to provide humanitarian aid.
Thanks to you for the interview.
Nelly raised some incredibly interesting points and shed light on some of the difficulties women face working in humanitarianism. One thing that really stood out in her responses was how cultural norms impacted on her ability to reach beneficiaries in the field.
She talked about how being a woman makes it easier to provide maternal health services, especially in contexts where norms make it difficult for male healthcare workers to access female patients. While this trend demonstrates the need for female representation, it can also be troublesome. It can contribute to pigeonholing and hinder the participation of women in other domains. As Nelly mentioned with her example of midwife demographics, equitable representation does not mean having a majority of women working in one field.
On the other hand, Nelly discussed how being a woman can act as a barrier in the profession. Nelly gave an example of when she was working in Afghanistan under the Taliban, and she quoted, some of them were so strong, forget about being women talking to them, unquote.
Essentially, being a female aid worker can be both an assessed and barrier to accessing beneficiaries depending on where you are working and what service you are trying to provide.
Another point that she brought up that is somewhat tied to gender norms is concerning the lack and fragility of female representation, especially in high-level positions. This notion of fragility raises the question of how to ensure female representation in leadership is not short-lived and superficial. She highlighted how MSF leadership used to be largely composed of women, but has now returned to men. We see disparities in the high-level positions of the UN system as well. The 2021 report to the Secretary General on the improvement of status of women in the UN system found that women make up over 50% of entry-level positions, while men make up the majority of all higher-ranking positions.
The problem of equitable representation is one that all organizations must continue to grapple with moving forward. It is not enough to only include women when women's movements are making headlines. Achieving gender equality will require sustained and devoted efforts both in the internal and external operations of aid organizations. While quota systems can be a way for women to get a foot in the door, they can reinforce superficial rather than substantive representation.
There is actually a lot of the research on the importance of including women at the highest level of the humanitarian organizations, but it remains important to discuss. Women and men are not the same, so it is worth analyzing the importance of employing more female leadership. Even further, it could be interesting to look with an intersectional lens, as women are not a monolith.
It is vital to ensure that women in the local communities are being consulted and included in aid operations. Like Nelly said, the women on the ground often know who to talk and what's going on. Even if they lack official power, the knowledge and connections they have make them powerful and essential in understanding the situation on the ground.
She also mentioned how societal and personal constraints can impact female aid workers and how they influence one another.
The point that pregnancy and having a family can be a barrier to female participation is true for many different professions, but seems especially restrictive for women wanting to work in the field. Nelly mentioned that when she had her children, MSF's rules were more lax concerning workers being pregnant in the field. It is easy to imagine that being pregnant in a conflict zone adds to a level of complexity and potential danger. Unless a woman does not want children or pursues an alternative method like adoption or surrogacy, then having children can lead to a disruption in her career that men are not necessarily susceptible to.
While pregnancy can be seen as more of a biological constraint, the post-pregnancy impact of having children on a woman's career is more tied to societal expectations. The unequal global distribution of care work means that women are performing domestic duties, such as taking care of children, more than men. Despite progress made towards protecting women's freedoms, the perception of mothers as the primary caregivers persists.
Overall, it is clear that a lot of work remains to amplify and include women in humanitarian work, especially in leadership roles. As representation increases, we must ensure that we do not leave a gender gap in leadership positions. There must be greater pressure from the international community for aid organizations to consider highly qualified female candidates for top positions.
In the field, it remains vital for the success of aid operations to continue to employ women and to engage with the local women in the community. In more conservative places, women may be able to go where men cannot and access beneficiaries that men may not be able to. Without women aid workers, aid operations risk excluding some of the most vulnerable populations from their programming.
Many aid organizations work to improve gender inequality in other countries, but do not recognize the inequalities their own female employees face. There are concrete steps we can take to support and elevate women in the field of humanitarianism. The question is whether or not organizations are willing to do so.
We want to once again thank Nelly Staderini for taking the time and share with experience with us, as well as a big thank you to everyone for listening.